Good morning. Actually, I should say good afternoon. Good afternoon. Welcome back to the channel. I hope that everybody is doing well. Today is Thursday, and my goal was to do Think Thursday videos. So every Thursday I would post something that was educational for you, whether it be for your boards exam or entering into practice. That's still my goal, but here in Michigan we had this horrible storm and a lot of us lost power and internet, my family included. We actually just got it back last night. But so I've been without any internet. I've been living like the freaking prairie on the farm over here. No, I'm just kidding. But like I did not realize how reliant I was on internet and technology and Wi-Fi. So it was kind of a wake-up call to me. Regardless, what I'm trying to say was that I didn't have time or, well, the ability to really kind of get on and create content for this Thursday. So I just finished actually a shift at the urgent care. I only worked 8 to 2 today, so it was super easy and quick. We were pretty slow. And what I thought I would do is I wanted to basically make a video to go out today because I still want to continue producing content on Thursdays at minimum, if not more. And I want to make it something educational, but I'm not going to do like a whole presentation with a PowerPoint or anything like that. What I thought I would do instead was just kind of sit down with you guys and give you some pointers if you are going to work in the urgent care. I've done a few videos like this before. These will be different pointers that I have. I believe I'm trying to remember what I've said in the past. That being said, I think they are different. I'm coming up to a year and a half now working at the urgent care. And so after I hit a year, once I hit a year, I should say, I felt very confident in my role. And I still continue to learn something new every day. I never stop learning. I never stop researching. But I am definitely more confident in my role. And I love teaching. And I love teaching and our new hires and our new NPs and our PAs. And so I want to bring that to you guys on this platform here. So if you're going to work in urgent care as any kind of mid-level provider, I suppose if you're a resident or something else, I just don't know if you're going to be watching my channel, but I assume that'd be just as helpful for you too. So I'm just going to give you some pointers that I have if you're going to work in the urgent care, and this is something, if this is a new role for you. So one, and this should be kind of basic, but it's a good reminder, ABCs, airway, breathing, circulation, that all still applies here. So making sure that your patient is stable, whatever that may be. Not necessarily breathing, but obviously breathing. Are they breathing? Are they in any kind of respiratory distress? If they're talking even sentences to you, they're not tripod breathing, they're not tachypnic, their pulse ox is obviously normal, they're not cyanotic or anything like that, then you should feel confident that they're not in respiratory distress. But obviously that's going to be the priority every time that you go to see a patient, making sure that they have stable vital signs. If they're very hypertensive, have them sit in a room for 20 minutes and then recheck it. A lot of times it'll go down. Anytime that you have an abnormal vital, recheck it. Make a habit of always rechecking it. And then obviously if it's consistently abnormal, if they are hypoxic, administer, oxygen and call for transport, or we'll talk to the patient. Sometimes patients have refused transport still to the ER, even with unstable vital signs. And all you can do then is document and call the ER that you're sending them to in hopes that they go straight there. But ideally, if anyone is unstable, you want them to go by ambulance. And so if they're hypoxic, administer oxygen, have them sit upright, keep an eye on them, call 911. If they're very hypertensive, and I made a really great video about this, about how to manage hypertension in the outpatient setting, and so I'm not going to go into depth about that, but number one, recheck it. Recheck their blood pressure in like 20 minutes after they sat down and calmed down, and see that it's actually as elevated as the initial reading was. A lot of times it won't be. Did they take their blood pressure medication? Are they having any signs of cardiac, like are they having chest pain or shortness of breath, headache, vision changes, anything like that? And then, so that's always going to be number one. Every time you go to assess a patient, are they stable? Are their vitals stable? And make sure you get in the habit of always checking your patient's vital signs. And it sounds silly, but it can be easy sometimes to forget to check their vitals. You just look at their chief complaint, their history, and you go in there and you miss that their blood pressure is 200 over 100. So just really get in the habit of every time that you go to see a patient, you check their vitals and make sure they're stable. And if they're not, if they're abnormal, recheck them. And this kind of ties nicely into my next point, being that whatever you see in the chart before you go to see the patient, their chief complaint, their medical history, their allergies, their vital signs, all of those, definitely review them before going in, but then confirm them when you go in. Don't make a habit of believing and reading everything you see. It's no fault of the MAs. Sometimes they just didn't ask. Sometimes they misheard or didn't know a medication and they put the wrong medication in. But I see this more often than not, where, you know, the list of medications or the list of allergies aren't documented correctly. And so being that you're going to be the provider and potentially prescribing medication, you obviously want to confirm that they don't have any allergies or drug interactions with whatever they're currently taking. A perfect example would be something like Paxlovid. Being in the urgent care, I write for Paxlovid quite often. Unfortunately, this drug has a lot of drug interactions, and so you really want to be familiar and make sure that you have an up-to-date, accurate med list. I just had a patient today who tested positive for COVID and was requesting Paxlovid, and you know, based on her medical history, she was definitely had some risk factors, but she was on daily alprazolam, MS Contin for pain. She was a cancer patient. She was also had a seizure, Lamictal she was on. And so all of these medications have drug interactions with Paxlovid. Paxlovid essentially slows down the metabolism of these drugs, making it more dangerous because they build up these higher levels of these drugs in their system. And so she actually wasn't a great candidate for Paxlovid. The point here is that those meds weren't listed in her chart. And had I not confirmed those with her, I might have just wrote for Paxlovid and not thought twice about it. But so my point here is that you always confirm your medication or your patient's medications, allergies, their medical history, and their chief complaint. A lot of times they'll read a chief complaint and you'll go in and it'll be totally different. So just keep that in mind. Definitely review. It can be helpful for you to kind of get your mindset on what you're going in to take a look at. But at the end of the day, when you go in and assess your patient, confirm all of those things for yourself. Okay, so my next point for working in the urgent care, you are going to see a ton of infections, viral infections, some bacterial infections, obviously not as much because those aren't as prevalent as viral infections, but you're going to see a lot. For example, upper respiratory infections. It's just a thing. You'll see it all the time in the urgent care. It's easy for patients to come in versus go to their primary care, just stop in at the urgent care, or a lot of times primary care don't see their patients when they're sick or symptomatic still since COVID, which I don't know when that's going to end, but they'll actually defer their patients to the urgent care setting. And so my best advice to you would be to get confident with differentiating between a bacterial and viral infection. Otherwise, you're going to be handing out antibiotics to every person that walks through that door. And trust me, a lot of them will request antibiotics. And it's going to be your job to practice antibiotic stewardship and educate the patients on whether or not it's indicated. And more often than not, I would like to say that patients, if you educate them and you tell them why or why not antibiotics are not indicated, and the symptoms and side effects that you're trying to avoid by giving unnecessary antibiotics, usually they're pretty receptive to that. Every now and then you will have some difficult encounters where patients are really adamant about getting antibiotics regardless if they're indicated or not. So the best thing that you can do going forward would be to become confident on those signs and symptoms to look for with bacterial infections, so you can confidently portray those to your patients. For example, if they had a viral infection that was getting better and then got worse, that can be an indicator for bacterial infection. Length of symptoms, this has been going on for 2 weeks and it's not getting better. High-grade fevers, immunocompromised. You know, if you're concerned for pneumonia, do they have focal consolidation when you're listening to their lungs? Do their vital signs reflect, a bacterial infection, like the high fever, tachycardic, hypoxic, all of these things? It really has to paint a whole picture. It's not very clear, black and white. And so you really have to use a lot of clinical reasoning. That being said, majority of the time, patients have viral infections. It's not often bacterial. And so it's going to be really helpful for you going into practice at the urgent care if you become competent in what indicates bacterial infection, what indicates viral infection, and being comfortable with explaining that to your patient. Okay, so my next tip of advice would be to find a way that you feel comfortable confidently explaining to your patient, hey, I don't know the answer, I'm going to leave and come back. And so I have done this multiple times, and it can be a little intimidating at first, but it's okay if you don't know the answer when you first go to see the patient, especially starting as a new grad NP or PA or whatever, entering an urgent care. You're not always going to know the answer right away. Ideally, once you get really confident in your role at urgent care, you go in and assess your patient, and more often than not, like 90% of the time, you know what you're diagnosing your patient with before you even leave the room. That's after you become seasoned and really confident in your role. Oftentimes in the beginning, that won't be the case, and that's totally normal. It's acceptable. It's fine. We've all been there, and still to this day, I have moments where I'm like, wow, I don't know what I'm looking at. I need to go review the literature, review the text, consult somebody, and so find a way that you feel comfortable explaining that to your patient. And so in those situations, when I find myself in those situations, I often tell the patient, like, hey, I think I know what I'm looking at, but before I treat, I want to make sure that I'm doing everything accurately. So let me go review something really quick and I'll be right back. Or let me go consult a specialist because that's their area of expertise and I just want to confirm what I'm doing is correct. I always kind of try to lead them with, I think I know what is going on. I'm pretty confident, but I want to confirm to best protect you. And they're usually pretty okay with that. That makes them feel like, okay, so they think they know what's going on, but they're just trying to make sure they do everything accurate and correct. And I mean, that is the truth. Oftentimes I feel like I maybe know what's happening, especially like a dermatological complaint is a great example. Rashes are a great example. Dermatology is tricky to me. I find it tricky, and a lot of rashes look kind of similar. Again, I'm not going to go down a whole spiel about this, but with rashes, you really have to look at a whole picture, and really there's great ways to kind of narrow down your differential with just questions that you ask with rashes. Maybe I'll make a video on it because those have always been pretty intimidating to me. I know I'm not alone on that, but that's a great example. Be like, hey, I think I know what I'm looking at, but let me go review something really quick before I treat you for this or whatever it is, if it's symptomatic or what, and I'll come back. Or, hey, I know someone that has, an expert or a specialist in this field. Let me go consult them. You might be consulting a textbook and that's the expert. But regardless, just let them feel like you're confident, even if you're not, because we've all been there. No one knows everything all the time, doctors included. I hear it all the time. So if you're not confident, just try to fake it till you make it, I guess is a great way to put it, and come back to the patient's room after you review some material. That being said too, if you know you're going in to see a rash, if you're certain about that, maybe review some images of rashes before you go in. It just kind of helps you understand, helps you know what you're looking at a little bit, because those can be tricky for anyone that doesn't specialize in dermatology. They get tricky. All right, and then my final tip is for orthopedic complaints. And it's really easy. Did not come up with this on my own. This is kind of like a golden rule, but if you haven't heard it before, you need to hear it before going to work in the urgent care. And the saying is, when in doubt, splint. If you are not sure when you're looking at an x-ray if there's a fracture or not, when in doubt, splint. That is the best thing you could do. Even if you're overdoing it, even if they don't have a fracture and they didn't need the splint, it's better to overtreat than undertreat in these situations, because if they have a fracture and you send them home and they are not splinted, they could potentially get a further injury and more complications. So when in doubt, splint. Even if you don't see something on x-ray, especially if on clinical exam there's a lot of swelling, they have decreased range of motion, the traumatic injury, x-ray doesn't look like anything, but you're not sure, splint them. That is the best thing that you could do to protect that patient from further injury. And then refer them to an orthopedic. And if they find out that there was nothing there, they're going to be honestly thankful that they were splinted versus had they found out something that there was a fracture and they weren't treated. I encourage you to do a lot of research if you are going in with a limited knowledge base on interpreting x-rays, because I'm assuming my urgent care, we see orthopedic injuries many, many times a day. And so the best thing that you could do would be to review the literature on that. But at any point, if you're in doubt, just splint the patient. That is the best thing that you could do. All right, but I think that's going to be all for today's video. Hopefully you found these tips helpful. I love educating, like I said, our new hires in the urgent care. And so if anyone's watching this that's entering into the urgent care, hopefully you found these helpful. I think these are really some helpful tips, really important tips if you're going to practice in urgent care. If you have any questions as far as going to work in urgent care, leave them in the comments down below and I'll do my best to answer them. Don't forget to learn something new every day. And until next time, I wish you guys nothing but the best. Okay, bye.
Step 4. Everybody just do your thing. Wake up, today's gonna be a good day. 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 Yo. Set your affirmations, aspirations. I got shit to do, the aftermath of preparation. Good food, good mood, blood in circulation. One step back at a time, yeah, that's how you make it. Set a goal you control and the steps you take them. I try to pick one thought, have some concentration, and if I make a mistake, it's called education. I try to do this every day, call it replication. Wake up, today's gonna be a good day. Wake up, today's gonna be a good day. Wake up.